Depression. It's a word we hear often in conversations with friends, in the media, and even in passing comments. But its true weight is often misunderstood. We toss it around casually, saying things like, "I'm so depressed about failing that test." But clinical depression is far more profound than a fleeting feeling of sadness. It's a serious mental health condition that affects millions worldwide. Imagine a heavy cloak, invisible to the naked eye, weighing down on a person's shoulders. That's what living with depression can feel like. A constant burden affecting thoughts, emotions, and behaviors. It's not a sign of weakness or a character flaw. It's a real medical condition, requiring proper diagnosis and treatment. And it requires understanding, compassion, and effective treatment to help those affected manage their symptoms. We all experience sadness from time to time. It's a universal emotion that everyone feels at different points in their lives. It's a natural human emotion, a response to loss, disappointment, or challenging life events. These moments can be tough, but they are a part of the human experience. We might feel blue after a breakup or when a cherished relationship ends. Lose sleep worrying about an upcoming presentation or a significant event that's causing anxiety. Or have a temporary dip in our mood after a stressful day. These are all normal reactions to life's pressures. These feelings are entirely normal and usually fade away with time and self-care. Activities like meditation, exercise, or spending time in nature can help. But what sets sadness apart from clinical depression? It's crucial to understand the distinction. The difference lies in the duration and intensity of these feelings and how much they disrupt your daily life. Depression is more than just a prolonged sadness. When sadness lingers for weeks or even months, significantly impacting your ability to work, study, sleep, eat, or enjoy activities you once loved, it's a sign that something more serious might be going on. This is when it crosses into the territory of clinical depression. Clinical depression is a pervasive and persistent mood disorder. It affects every aspect of your life. It's not something you can simply snap out of with willpower. It requires understanding, support, and often professional help. Imagine feeling a profound sense of hopelessness and despair that colors everything you do. This is the reality for many who suffer from depression. Simple tasks feel overwhelming, and even getting out of bed in the morning can be a monumental struggle. The weight of depression can make everyday activities seem insurmountable. This persistent low mood is a hallmark of depression and distinguishes it from the normal ups and downs of life. Recognizing this difference is the first step towards seeking help and finding a path to recovery. Depression manifests in various ways, affecting individuals differently and often unpredictably. Its symptoms can differ significantly from person to person, making it a complex and multifaceted condition. While one individual might experience persistent sadness and tearfulness, feeling overwhelmed by emotions, another might feel emotionally numb and disconnected, as if they're merely going through the motions of life. Some people with depression withdraw from social interactions, isolating themselves from friends and family, while others might become irritable and easily agitated, reacting strongly to minor inconveniences. Recognizing the signs and symptoms of depression is crucial for seeking timely help and support. According to the DSM-5, a diagnosis of major depressive disorder requires 5 or more symptoms for at least 2 weeks, with at least one being either depressed mood or loss of interest or pleasure. Depressed mood most of the day, nearly every day. This can manifest as feelings of sadness, emptiness, hopelessness, or tearfulness. Loss of interest or pleasure in activities once enjoyed. Things that used to bring joy now feel dull and unappealing. Significant weight loss or gain, or changes in appetite. You might find yourself eating more or less than usual. Insomnia or hypersomnia nearly every day. Difficulty falling asleep, staying asleep, or sleeping too much can all be signs of depression. Psychomotor agitation or retardation. You might feel restless and agitated, or slowed down and sluggish. Fatigue or loss of energy. Even simple tasks can feel exhausting, impacting your productivity. Feelings of worthlessness or excessive guilt. You might berate yourself for past mistakes or feel like a burden to others. Diminished ability to think or concentrate, or indecisiveness. Depression can make it difficult to focus or make decisions. Recurrent thoughts of death, suicidal ideation, or suicide attempts. These thoughts require immediate attention. These symptoms must cause significant distress or impairment in important areas of functioning to warrant a diagnosis of depression. If you recognize several of these symptoms in yourself or someone you know, seek professional help. Early intervention can make a significant difference in managing depression and improving quality of life. As we dive into the physical changes, it's important to understand how our bodies respond to various stimuli. From hormonal shifts to the impact of lifestyle choices, these changes can be subtle or quite pronounced. They can affect our mood, energy levels, and overall well-being. Understanding these changes is crucial for managing our health effectively. Genes, environment, and life experiences all play crucial roles in shaping who we are. While our genetic makeup provides the foundation, our surroundings and the events we go through add layers of complexity to our development. These factors interact in unique ways for each individual, influencing mental health outcomes. Seeking help is not a sign of weakness, but rather a step towards better health and well-being. Whether through professional counseling, support groups, or talking to loved ones, reaching out can make a significant difference. When it comes to treatment options and support systems, there's a wide range of resources available. From medical treatments to community support, finding the right combination can lead to a more balanced and fulfilling life. Medical treatments include medications and therapy, while support systems can involve family, friends, and community groups. It's important to explore these options to find what works best for you.